Hello, everybody, and welcome to February's webinar of Basics and Beyond. And I'm really excited to be here with my amazing colleague, Tracy, but my name is Kathy Randall. I'm a neonatal nurse practitioner, and I'm a huge fan of bedside brain monitoring and love what multimodal monitoring brings to us, and have the chance sometimes to go out and to educate customers in the neonatal space who are using this device. So that's me in a nutshell.
Thanks, Kathy. And I'm Tracy Berlin. And Kathy and I complement each other very well because she lives in the neonatal world and I typically live in the adult world. So I get to go out and do a lot of great fun education also on multimodal neuromonitoring. So Kathy and I had this great idea a couple months back to get together and just share with you all what we know about the CNS monitor. We know you're using it, or perhaps you're considering using it, and we can kind of help you in some of the inside tips and tricks. And so we've had a different type of program each month. Actually, every other month we've been doing it. So I think with that, I am just going to wave hi to everyone, and I'm probably going to go off of my video because it's distracting. So, so I'm going to stop my video. One of the things that I would like to show you first, if you have not been on the Moberg ICU Solutions website, is just Google Moberg.com. This is the home screen, and then you find the education button. And if you tap education, you'll see a whole list of things that you can tap into in terms of learning material. So if you actually go to videos and webinars, what you will find are all of the previous webinars that we have done, but there are also monthly webinars put on by Moberg that have a lot of great featured speakers. So we have the Brain Matters webinars. But if you scroll down, you'll find our webinar from December, you'll find our webinar from October, and you'll find our webinar from August of last year. So you can go back and forth, and you can find all of those as well. So I'm going to do now a new share. So what Kathy and I thought we would talk about today is how to edit not only just displays within your protocol, but to actually edit a protocol. So to change things as you need to, potentially for an individual patient, but then more often for if you want to add a new protocol to your hospital, if you want to have a new way to actually look at information. So let's kind of start basic. What is a protocol? So a protocol is actually a template to be used for monitoring. I know in the hospital when we talk about protocols, we talk about them in terms of guidelines of care. So this is a little bit different concept, but it still fits that same definition of a template. So when the CNS monitor arrives at your institution, it has very few protocols. There's sort of a basic EEG protocol and maybe a little vital signs protocol built into it. And then typically what we do before we come on site for training, excuse me, is we reach out to you and we ask you what devices are you interested in connecting to, and what particular measurements do you want to get from that specific device? And then we build a template protocol for you, and you then have that to use on your patients. But as time goes on, your protocols may change. You may get different patients, you may get different devices, you may decide to add things or take things away, and you may have the need to change your protocol. When you pull up a protocol, you can edit within that protocol, or we can just kind of start over and have a new protocol. So let's talk about a couple of different ways that we can change things. When you first get your CNS monitor, you likely only have a longitudinal bipolar protocol built in, and then a vital signs protocol. So the longitudinal bipolar is an adult EEG montage, and it allows us to have EEG as sort of the basis of our monitoring. If you're just using a vital signs protocol, you'll notice there's no EEG there. So some institutions don't use the CNS monitor for EEG monitoring. So they can actually build a protocol off of just the vital signs protocol, or they can build it off of the longitudinal bipolar. Or we also have little smaller montage protocols that are very appropriate for the neonatal population. So Kathy, I'm guessing most of your neonatal populations will start with this sort of bicentral biparietal, which just gives us a couple of little electrodes. Mm-hmm. And then we also have just the biparietal. So that's an even more limited montage for our little neonatal babies.
And that would be really for a unit who is primarily going to use the AEEG trending for bedside trending and monitoring versus what other, depending on how the group is set up, they may have a neurology team also using the Moberg device, and they would want the full montage collected, but then we would edit the display and show only those limited channels that we display as the trended AEEG. But for units that are just doing AEEG, the biparietal would be what we would call the old world single channel, or the biparietal bicentral would be what would be kind of a 2 or 3 channel AEEG that might be comparable in layout to make the Olympic OBM, or if you have an older Brain Z device, something like that.
Great. So what I did this morning is I pulled up just this basic longitudinal bipolar type protocol, and I thought we would kind of start with that. It's a larger montage. You can see there's lots of different electrodes, but we can start to add devices and we can kind of build from there, and I'll show you how we can actually go ahead and change things. So in a typical longitudinal bipolar montage, we have a set EEG pattern, but then we also have measurements that are coming from some relatively standard devices. So we have things like our ICP and perhaps our CPP and our brain tissue oxygen coming from different devices. On our neurovital signs display and our regular vital signs display, we have this particular monitor set up to gather information from a Philips IntelliVue, which is just one type of bedside cardiac monitor. But let's kind of take a look at how we can change things individually for a patient, or if subsequently we then want to change it for the entire protocol, we can do that as well. So if, for example, we do not wish, I'm going to just kind of go back to our neurovital signs screen. And most of the default protocols come with this Glasgow Coma score. This is actually a manual entry. So a lot of hospitals don't use this because we're already manually entering our Glasgow Coma scores for the adults into the medical record. So we might want to change this to something else. So to change a particular parameter display within a particular screen, we can simply tap on it. It becomes gray. And then we're going to go up to this little Edit Selected button at the top. And then we have the opportunity to change the measurement, to change the time scale for the entire screen, or to change the amplitude scale, which is the range out at the side. So if I want to look and make something on this screen that is not necessarily GCS, I don't have a whole lot of options within the neuro field because I haven't really enabled any different measurements. But perhaps on this particular screen, I want to add some type of an EEG metric because it's neuro. So I can go perhaps to we'll kind of pick up on what Kathy was talking about with the AEEG, and maybe I just want to add a little channel of AEEG, and I can easily do that. So I've changed from a parameter that I didn't want to something that I did want. It's also possible to have channels that are vacant down at the bottom so that you can add things a little bit later. So let's just go ahead and we'll make that vacant channel something else. We'll make that another AEEG channel, and we'll go this way this time. Okay, so now you can see we've changed, made some changes to this screen. Anytime you add anything or you take anything away, you are effectively changing the protocol. So when we discharge the patient, we need to figure out, are we going to save those changes and incorporate them into a new protocol, or are we going to discard them? So that's an easy way to make changes to what you're seeing on a particular screen for a particular patient. So that's one of the nice features about the CNS, is that you can customize it for exactly what your patient has. Now, maybe I don't see something that I want to add. And if I am looking for a particular measurement and I can't find it, so let's say I have arterial blood pressure, but I want to actually look at the non-invasive blood pressure on my patient. They don't have their arterial line anymore. I want to look at a cuff pressure. Normally I would go into hemodynamic and I would try to find NBP, but I don't have that choice right now. And the reason I don't have it is because that parameter or that measurement has not been enabled. So if you can't find something, it's very possible that that measurement was just never selected from the beginning. So to find and add different measurements that we want, we're going to go to the main menu button down here on the lower left. We're going to tap, first we should probably check our devices, and we should make sure that all of the devices that we want are actually available. So under patient monitors, we've got our Philips, but we could change that to whatever other type of monitor we have. Under our neuro monitoring, we could check out all of those monitors, make sure everything is selected that we might possibly need. And when we're done with that, then we want to check and make sure that the measurements are also enabled. Just because we have a particular device enabled doesn't necessarily mean that all the measurements associated with that device will automatically be available. So we may need to look at different measurements. So we're getting our arterial blood pressure. We might want to get our CVP from our Philips monitor. And I'm going to scroll down here and see if I can find my non-invasive blood pressure, which is NBP, because that's the one I want right now. And here it is, and you'll notice it says none. That means that that measurement has not been enabled. So when I click none, then I can choose the monitor that I think that I would like that to come from. And so I can scroll through any of the hemodynamic measurements. I know sometimes in the neonatal population, they might measure the umbilical atrial pressure or venous pressure. So maybe we want to grab that if we're working with our little babies. Under neuro, we might want to go through and just make sure that everything we want is actually going to be available to us. So maybe we're using a Bowman perfusion monitor, we can select that. Maybe we're using the pupillometer, we can select that, and then all of those measurements will also correspond. We'll check out our respiratory, make sure that we're getting all of those measurements that we need, and our temperature, and make sure that we're getting those as well. So now if we go back to that menu we were on, and we're trying to change the arterial blood pressure to a non-invasive pressure, again, I'll go up to this edit selected, and now we choose hemodynamic, you can see that that non-invasive blood pressure is now available. So one of the biggest things we hear from folks is like, I'm trying to add something to the display, but it doesn't seem like it's available. And likely it's because the measurement was not enabled from that main menu. So just go back there and find it. And there we have it. One of the things that I'll bring to your attention on measurements that have a triad. So for example, a systolic, a diastolic, and a mean. Oftentimes the label over here will just display the mean because that's what the trace, that's what the trend is showing, is the mean value. But often clinically, we want to see the entire systolic, diastolic. So instead of tapping in the middle of the parameter, if we just tap the label and go to edit selected, see how the readout is following the trace? We can actually change that to make it follow the systolic, diastolic. So this is going to display things in a fashion that's much more familiar to you because this is what it looks like up on your bedside monitor. So that's just kind of a little tip or trick.
Tracy, I just have a quick question.
Yeah.
So in some units that are, going through retrofits and things, they might have some devices in one room. I'm thinking the physiologic monitors. They might have some older generation or a totally different brand in one area, and then they have a different brand in another. What would be the best practice for those units? Would they want to make sure they enable all of their legacy devices in there just in case, or would you make two different protocols?
That's a great question. And I think it's going to be up to how savvy the users are in remembering to switch back and forth between devices, or it might just be easier to have two different protocols. You could label a protocol to be used with, say, a Philips monitor, or label another one that perhaps is in use with a GE monitor if you've got two different, for example, types of bedside monitors. Okay. You can easily enable both of them. So if we go to patient monitors, we can certainly indicate that both of them are recognized. But even if we do that, when we get to something like, let me go to the vital signs, when we get to the heart rate, right now it says that it's pulling that information from the IntelliView. You can kind of see where it's getting the data from.
So if you're blank,
yes,
plugged into the GE. Okay, I just wanted to clarify that.
Yeah, so if you hooked it up to your GE CareScape, you would not be getting a value. So what you would need to do is go back to your main menu and your measurements, select the measurements. We'd have to go to our heart rate. And instead of pulling it from the Philips, we would have to indicate that we wanted it from the GE. So if you don't see,
we would have to also go back and reconfigure that band as well.
It should pop in. Yeah, it should pop in. So let's go back to our screen now and see what's happened.
Okay, it did update there.
So it should update that it's getting from the CareScape. Now I'm in demo mode. So I have this kind of tricked into thinking it's getting everything from the Philips. So it may not show data that's actually coming from a CareScape.
Okay, but if you enabled it, it does switch, but it may just not give us a trace for right now. So I'm just thinking that, like I was saying, there are some NICUs especially, and I'm sure this is happening in the adult world and PICU world as well, and that these, the units are being retrofitted and changed and remodeled, and we're not always getting enough capital to switch out all our devices, or an isolation room ends up with like the old ones.
Exactly.
And for cooling, people are changing from one type of cooling mattress, they might have 2 of something and 3 of something else. And so I was just trying to think ahead for people about how to handle that. And I like the protocol, labeling the protocol with maybe a clue towards, like this is for your Blanketrol protocol, or this is your Arctic Sun protocol.
Exactly. Yeah. So when we discharge this patient, we'll look at how we might rename a protocol based on the changes that we've made.
Great. Thank you.
That's great. Okay. So another way that we can make changes on a particular display fairly easily. Let's say I want my temperature now up at the top, and I may want to add or take away a couple of things. I'm not just making one change. I'm actually going to switch this back to our, if you don't mind, I'm going to switch our heart rate back to our Philips, just so that it gives us some data. Okay, that's done. We can tap in any one of the fields, go up to our Edit Selected, and now you see the button down here where it says Edit the Display. This is a nice way to make multiple changes within a particular display. So if I tap Edit Display, it brings me to that exact display that we're looking at, and here is everything that is on that display. Maybe I want to move things around a little bit. Maybe I would like to see my temperature up a little higher in the pecking order. If I tap T-Core, then there's a button over here on the far right that says Move To. I want to put that up at the tippy top, because for this patient, for me, temperature is more important. So I can rearrange things as I feel like I want to. I can also completely delete a trend. So maybe I don't want to see CVP on this particular display or for this particular patient. If I tap CVP, now I can completely delete that one. I can also add something else. I can add a completely different trace. So if I hit Add a Trace, I can choose from hemodynamic, I can choose from neuro, I can choose from whatever I would like to. So maybe I want UAP on this, and I can do that. So if you want to make multiple changes within a particular display, using that display editor is very, very helpful. Anytime you make a change, you're going to have to, down at the bottom, review those changes first. You can undo your changes, but you're going to have to review them first. And then it will ask you whether you want to save them or get rid of them. So another thing that you can do is you can add a completely different area to your display. So I'm going to go over to the left side now where it says Add the Area. Maybe I want to put up a little bit of a waveform along with this display. So maybe I want to choose a different type of trend in my EEG, and maybe I want to look at my AEEG on the same page as some of my vital signs. I'm going to add one more under EEG metrics. So I'm going to review those changes, and this is what we had to start with. This is what we're ending up with that we've selected, and I'm going to hit accept changes. So now you can see we have a very different looking screen, right? So instead of our neurovitals screen where we've got things similar to that, I kind of sort of just built the same looking page under vital signs. But we have more information here, and then we've added other things to it. So going into the edit select and then doing edit display, that's how we got to that. So that allows us to make a lot of changes on a particular display.
Trace, would you go through when you did the add area and maybe give a little description of the different options for the areas? Because you said there was the waveforms and trends.
Sure.
And maybe that would be helpful for people trying to make a decision. Yeah,
let's talk about that. I'm going to go ahead and delete these guys just to give us some room to look. Okay. So
you can actually delete the area there too.
I can delete that whole area this way. Okay. So if we add an area, we have the opportunity to add additional trends. So trends are similar to what we already have here. So your temperature, your heart rate, your blood pressure, these are all called trends. If we want to add additional trends, I'm going to go into trends. It allows us to pick trends, again, from our hemodynamics, our neuro, just like the other ones are. But one of the things I like are the EEG metric trends, because that lets us look at all of that information as a trend. So that's where we put that AEEG in. But maybe I want to look at the alpha waves on an EEG. Again, I would pick those values and pop that up. The other thing that we can do is, instead of adding trends, is we can add an area of waveforms. So maybe I want to see what my EKG or my heart rate waveform looks like along with the value. So I can choose my ECG. And maybe I want my blood pressure. Whoops, sorry, maybe I also want my blood pressure. So I can look at my ABP. And if I review those changes and accept them, now I have some waveforms right along with my trends. So that's certainly an option for that as well. Okay, I'm going to go into Edit Selected. I'm going to edit the display again. And this time I'm going to get rid of, I'm going to delete that whole area. So other areas are EEG waveforms. So waveforms are more like the physiologic waveforms we normally see. EEG waveforms are going to be our raw EEG. Then we can also add things like compressed spectral array and DSA. Those are the spectral displays that give us information about frequency bands and help to tell us. I'll just add one so that you can see what that looks like. So they start to give us information about possible seizure activity by assigning color to the different frequency bands. And at some point we might do like an EEG, processed EEG webinar to talk about some of the ways that EEG can be processed to be helpful for us. So let's go back and look at some of the other, whoops, I don't want to edit that specific one. Okay. All right, so if I want to go back and re-edit that display, I can do that. So that edit display button is kind of hidden there, but it can really be helpful in making multiple changes within a particular screen. And then the other thing we can do is we can look at impedance trends. That's for EEG. This numeric.
Sorry to interrupt you. It looked like you just deleted all your trends, and so I just thought it was a good opportunity to let people know that they could prevent, like, so right now you have just the DSA and you got rid of all those other things, but you could undo that or review and go back to whatever was the last saved protocol. So if someone is like, oh my gosh,
I just got rid of everything.
Everything I used to have.
Yep. So you definitely could undo that. So on this particular one, this is where we had our other trends. So I can just go back and pop them all right back on, add my trace, pop them right back in there. Heart rate, add my trace, hemodynamic, and pop them on again. Okay, and again, it's always going to ask you to review your changes. And then accept those or reject them. Okay, so now we have something very different looking than what we started from. But again, that edit selected button will allow you to make a lot of changes within a particular display. So another way to change your protocol is going down into the main menu. So if I tap the main menu button and I look at the fourth button down that says Edit Protocol, this allows us to work on multiple displays at once. So using Edit Display just lets us make changes within a particular screen. This lets us make changes to a lot of different things. The only thing we cannot change is the setup and the stop monitoring. Those are there all the time because they just need to be part of the admission and discharge process for our patient. But if we want to make changes within the nursing step, we can edit that particular step. And if you can see my cursor, I'm down here toward the bottom now. We can edit a particular display within that step. We did a lot of messing around with this vitals display, so we might want to do some more changing there. That's where it is currently. And then it brings us back to this screen that we just saw a little while ago where we can add areas, delete areas, add traces, delete traces, or edit traces, or move them around. Might cancel out of that. If we want to move things to different orders, again, we can do it from here. Maybe I want my waveforms a little higher up in the pecking order. Over here, I can reorder my display. So I can put things where I want them. So it gives you a lot of flexibility in how you're configuring your screens to look at things. I can even completely rename a particular step. So I'm going to go back to, sorry, don't want to do that. I'm going to go back to my, my steps. And I can edit a particular step again, and maybe I want to completely rename the step. So that step was called nursing, but maybe I don't want it to be called nursing. Maybe I just want it to be called trends. And I say okay. And then you'll notice when we back out that we've lost that nursing step, and now it's going to be called trends instead of nursing. I can add a completely new display. So maybe I'm doing cooling on a baby, or I'm doing therapeutic hypothermia on an adult, and I want to look at a screen that has all different kinds of temperatures on it. I can add a temperature display. And as soon as I indicate I want a new display, it tells me to add an area. So I'm going to look at my trends, and I'm going to add as much information as I can on temperature. Now, if I had activated from the beginning either my Blanketrol or my Arctic Sun and allowed those measurements to be brought in, then I could have picked a whole bunch of different other temperature measures, but we would have to go back and do that. So I'm just going to hit accept so that you can kind of see. I want to move my temperatures up because they're important. I want to see those a little bit better. And now I'm going to hit OK. So now when I look at my steps, number 2 used to be nursing, but we changed the name. We made it trends. And within our trends, we kind of changed the way that display looks, but we also added an entire new display called temperatures. And we rearranged things a little bit. So again, individual changes can be made just by tapping the field. Oops, let me go back to here. By tapping a field and hitting Edit Selected. So you can change an individual measurement. You can change multiple things on one display using the Edit Display. Or you can go into the main menu do edit protocol, and there you have the opportunity to work on every step and every display within a particular step. Okay, so now we've made quite a few changes, and when we go to discharge that patient, we're going to need to reconcile those changes that we've made. If you have made changes within displays for a particular patient, that's absolutely fine. But if your institution is used to using a particular protocol, you probably don't want to save all of those individual changes. So when we go to discharge a patient and we hit stop monitoring, and we confirm that we want to stop monitoring, it's going to recognize that we made a whole bunch of changes to that protocol. If in fact you do want to save those changes under a new name, then we would hit the Save As button. If we want to revert back to the original protocol, we would hit Discard Changes and it would go back to the original protocol. So if I hit Save As, maybe I've made a bunch of changes that we just want to continue to save. So we can say, we can call this a test protocol. So this is this kind of goes back to what Kathy was saying earlier, where if you have a particular set of devices that you're going to use with one protocol and a particular set of devices that you're going to use with another protocol, you could easily name it accordingly. So you could say maybe Blanketrol protocol, or Lycox protocol, or subarachnoid hemorrhage protocol, or TBI protocol. You could certainly build specific protocols according either to your patient diagnoses that are prevalent in your unit, or according to particular sets of devices that you typically would use. Now, we didn't add Blanketrol to this, so I'm not going to call it Blanketrol protocol, but we'll just kind of do test protocol.
So for example, for in the NICU, we could call it cooling protocol Blanketrol, and then cooling, or like cooling with Blanketrol, cooling with Arctic Sun, or cooling, and I know at Stanford we do like cooling plus AEEG, cooling only. So
perfect.
We've done it kind of both ways, where we've done what are the therapies, what's the population, and what is our tools, and been able to make our protocols really self-identifiable from that list right out of the gate as the nurse is setting up at the bedside. So maybe for different research protocols, you might be using, maybe you're dueling, you have, I was going to say dueling pianos, but dueling EEG devices, right? Or dueling pieces of equipment that you're swapping back and forth. And so having those named differently for that protocol, either by physician name, PI name, or even device name, I think can be really helpful.
Exactly. There are some hospitals that have physicians that manage their patients very differently. So Dr. Jones may always want this set of devices and these measurements, and Dr. Smith may always want this set of devices and measurements. So I've actually gone into hospitals and seen where when they go to select the protocol, they're selecting it according to the physician. So they have Dr. Jones's protocol, they have Dr. Smith's protocol, or it's by diagnosis. So, in the adult world, it might be, this is what we're using for subarachnoid hemorrhage, this is what we're using for TBI. So the only danger of having too many protocols, I'm going to go ahead and hit OK. And now we can actually indicate, why did we build this protocol? What was the purpose of it and who created it? So we can indicate those things there.
And I like to put the date.
The date that it was made. Yep. Mm-hmm. That's a great suggestion. I'm going to archive this patient later. The only danger in having a lot of protocols is that when you have to start up the CNS monitor to use it, you need to be very certain which protocol you're selecting and make sure to get the right one. Because once you select a protocol, you cannot go back and change the protocol you're using mid-session. So for example, if I start with our test protocol and then I decide I didn't really want that one, I wanted another one, I would have to discharge the patient and then readmit them under a new protocol. So we can't actually go back and forth. So it could be a little confusing to the user if you've got, 12 different protocols to pick from, which one they actually want. So just be a little bit careful of that. So the way that we just made those changes was during a monitoring session. So I had previously admitted a patient to the monitor. I started monitoring a patient, and then I started making changes from within an active session. You can make protocol changes even if a patient is not hooked up to the monitor, or the monitor isn't running. So say you want to start from scratch and just build a new protocol. We can easily do that. So the way that would happen would be under, we can do it a couple of different ways. We can do system configuration, and we can go to the protocols button there. And from here, we can pick a particular protocol and just edit that one. If we know that there's one that's kind of sort of what we want, we just want to make a few changes. We can create a new protocol. From here, we could delete protocols. So maybe that test protocol that we made is not something we're ever going to use. So maybe I want to delete that. So that deleted it. The import and export protocols buttons are used when we're sharing protocols between different CNS monitors. So if, for example, you made a whole bunch of changes to protocols and you want to replicate that on your other CNS monitors, a USB thumb drive can be put into the side of the CNS monitor. We could export a particular protocol to the thumb drive and then re-import that into another CNS monitor. That way, if you have 4 or 5 monitors, you've got all the same protocols. And we have some technical bulletins that we can share with you as to walking you through the specific steps of that. So maybe we just want to take a protocol and we just want to create a new protocol. So the 2 choices that you'll typically have are a protocol that has no EEG. So maybe you're an institution that's not using the CNS monitor for EEG purposes, you just want multimodal stuff. Or where it says full 1020 system, that's where we're starting with a full montage of electrodes. So we can create a new protocol. We can try to derive a protocol from an existing one. So we're not going to get too into the EEG stuff. That would take a little bit more time to walk through. But just know that there are ways that you can change a protocol. You can create a protocol when you've already got the system up and running for a particular patient, or you can just do it from scratch. You can do it from actually the home screen by using a system configuration. So you could be sitting in an office somewhere or whatever and creating protocols without actually having a patient admitted. So I hope that helps to outline some of the options. It's about 1/4 till. So I want to make sure that we have plenty of time for questions and discussion. And Kathy, feel free to fill in the gaps of anything that I have missed.
Sure. While I'm waiting for questions to pop up, one of the things, if you'll pull up a monitoring session, I just wanted to mention really quick a feature that I know I really like at the bedside, so I thought I'll mention it.
Sure.
And something that changes over time too is the main display and the ability. So the main display is kind of that rescue me. I don't really know where I am, and I came in here and I monkeyed around with my different displays.
I found it sitting on this, and I don't like this.
Yes, I don't like this. And I think as a bedside nurse, we all have like our favorite like display that we like to keep things on. The main display can really be any screen that we have, and you can change it.
Yeah.
And so I usually pick one that makes the most sense at the bedside for kind of like a general overview. But that is something that is part of the protocol that you can modify if over time you prefer this screen or that screen, or maybe for cooling patients, maybe you're using one of an existing protocol that's a non-cooling patient. And for cooling patients, I want temperature to be my main display. I don't want neurovitals or something. And so you can change that up. So I just wanted to mention that as
that's perfect. So the way we would do that is I went into the main menu, I hit edit protocol. And now I know that my main display choice is in this nursing step. So I'm going to edit that step. And you see here where it says that neurovitals is designated as the main display. Maybe I want it to be something else. Maybe I want my waveforms to be my main display. And down here on the right, it says select as main display.
Mm-hmm.
So I can easily change that. So now, no matter what screen I'm on, if I'm on an EEG screen, maybe I'm on an EEG screen. Now if I hit main display, it's not going to take me to that neurovitals screen anymore. It's going to take me back to my waveforms.
Mm-hmm.
Okay? So that's very easy to change as well. Thanks, Kat. That's great, because that's a good tool. If you're ever lost and you don't know where you are, just go back to your main display. And we typically default that to the neurovital signs screen. That's sort of something that we automatically do, but that doesn't necessarily mean that that's what you want for your institution.
Yeah, it just so depends on who kind of the main user is of the device, because if it's neurology, it is the EEG screen. If it's more bedside nursing, then we want to have it kind of on those kind of the overview pages usually.
Right.
But yeah, I thought that would be just another little tip that we could throw in there while we were waiting for any other questions to pop in.
That's a great one. That's a great one. Thanks. Any others? Anything else that you've played around with that you have learned and really like?
No, I kept thinking, I was like, oh, I'm going to ask her that. And then you went right into it. So I feel like we were really in sync on those. I think this whole thing about there being multiple, options for devices and naming your protocols according to the devices, just taking that protocol that you have that you like, and then just replicating it like Tracy showed, and then plugging those measurements in and saving that as, protocol dash equipment name, I think it's really going to save you time, and will just give you really that customization and flexibility to use the devices according to how you might roam the devices around in your unit.
Right. And if any of you guys are big EEG users and you really want to dive into editing the protocol according to like EEG electrodes and montages, just please reach out to us, and we can either do a separate webinar for those folks, or we can just help you out individually and make sure that you know how to change those more complicated EEG montages.
Yeah, that's great. So just to remind everybody, the steps are there on the left. So remember, 1 and 5 we can't change, but you can create as many customized steps as you want. Mm-hmm. And then the displays are those little buttons that are down on the bottom that then change as you move. So I think sometimes the terminology gets sticky, steps and displays, they're all just different ways of viewing different displays, but we call them different things on the side versus the bottom.
Right. Perfect. So a lot of people look at this integrated trends and say, well, what does that mean?
Right.
You can rename that. You don't have to keep that name the same. So if I do edit protocol and I say integrated trends, I want to edit that step. And I want to just rename that. I want to call it, I don't know.
Trends, maybe.
Yeah, just regular trends. Say okay. And okay. And okay. Now we've gotten rid of integrated and we've just called it trends. Mm-hmm. So there's lots of flexibility in how you can change things to suit you. We kind of guess based on our experience what you might need.
Yes.
When we get the monitors set up for you, but you're not locked into that at all. So like I know at University of New Mexico Hospital, I think, Nick, our protocol that we built there originally was called UNMH longitudinal bipolar. Well, that longitudinal bipolar is a pretty big mouthful. So you could actually go back and get rid of that name or change the name to whatever you want it to be. Nick's going, yes. Okay. Did we get any questions?
Must have been super clear, Trace. Good job.
Wow. Either that or I put everybody to sleep, and I hope that's not the case.
Well, I think everybody knows how to reach us if they need questions. I don't know if there are any other housekeeping or announcements that Gwen needs us to make, but I think she's on the line from Moberg's office as well. But I think
nothing from this side.
Great. So the other thing for those of you listening in is we really want this to be useful for you. So Kathy and I have kind of randomly been picking topics to cover, but we would love to hear from you guys as to what you want us to dive into. A lot of times we'll set our next session based on, the kind of genre of the questions that we're getting. So please just reach out to us and let us know if you have ideas for future sessions. And we seem to be kind of on the every other month plan. So Kathy, maybe we'll aim for April again.
Yeah, sounds good.
Okay, that's great. So no questions, no comments. You guys are a quiet group today.
Yeah. Polly said she liked something, so that's good.
Okay, cool.
I don't remember when she said that, but I'm glad that she liked it, whatever it was.
Good.
All right.
Oh, wait.
Go ahead. Oh, looks like a Q&A popped up. Oh, thanks, from John.
You're welcome, John. Thank you. Okay, guys, thanks for tuning in, and you'll be hearing from us with our next webinar and our next topic. And if you need anything, reach out. Otherwise, check out the website, and you'll learn a lot more stuff there as well.
Thanks, Tracy.
Thanks, Kath. Safe travels.
Thank
you. Traveling girl.
Thank you.
Okay, bye, everybody.